Welcome to Children's Specialized Hospital's inpatient facility, located at 200 Somerset Street in New Brunswick, New Jersey. We are the nation's leading provider of inpatient care for children from birth to 21 years of age facing special health challenges. So if you find yourselves in our care because your child has experienced a traumatic brain injury or spinal cord injury, is suffering from chronic pain or a chronic illness, or is in need of rehabilitative care for any other reason, rest assured that you are in the right place. Our hospital specializes in providing a broad range of complex medical and rehabilitative care for our patients through a variety of inpatient programs. And it is home to 2 centers of excellence, including brain injury and chronic pain and functional neurological disorders. Our vision is a world where all children can reach their full potential. And throughout this tour, you will see that everything we do is aligned to make that vision a reality. We understand that easy access to our hospital is an important factor to your inpatient stay, and we're happy to tell you that we are located in an area that's accessible by car, bus, or train. When you arrive by car, you will park in the Plum Street parking deck, which sits next to our facility. Once you park, make sure to take note of the parking level you're on and bring your parking ticket into the hospital with you, as we will validate it each time you visit to relieve the burden of an additional cost. The Sky Bridge that connects the Plum Street parking deck to Children's Specialized Hospital will bring you into the hospital's back entrance and the hallway of transformation. When walking through this hallway, you'll notice an accessible therapy playground and reflection garden to your right, and a meditation room to your left. These areas serve as reminders that we are all human. We need to keep breathing and playing and allow ourselves time to heal. We often utilize these areas for staff-guided therapies like yoga, meditation, and outdoor recreation. As you enter our lobby, you will be greeted by our friendly security team, who will help to ensure that you are well-informed and supported, assisting as you become familiar with our campus and your new daily routine. Our security officers, along with every other member of our staff, work closely with our patients and families to create and encourage a culture of respect and safety throughout each inpatient stay. Our 68-bed inpatient hospital is divided into 2 patient floors to accommodate patients aging from newborns to 21 years. Patient rooms on the 2nd floor are intended for school-aged children, teens, and young adults, while rooms on the 3rd floor house infants and toddlers. It's important to note that patient rooms are typically shared, so you should anticipate having a roommate. Each semi-private room will be located either close to the room's doorway entrance or window and will have a patient bed, parent and caregiver accommodations, a flat-screen TV, and storage space. Patients and families will meet many members of their care team in their rooms for the first time. Team members will come by shortly after you arrive to explain who they are, what their role is, what they plan to accomplish, and why. The interdisciplinary team includes doctors, nurses, therapists, educators, and specialists who will work closely with your family to establish a treatment plan designed for the unique needs and abilities of your child. Once unpacked and settled, the rehabilitation journey will begin, and your room is where therapy often starts. Activities of daily living, or ADLs, are important areas of focus, and your care team will work with you on daily tasks such as feeding, getting dressed, brushing teeth, and moving safely in and out of bed right in your room. Out-of-room therapies like walking, endurance and strength training, social skills, and aquatic therapy are scheduled throughout the day based on the individual needs of each patient. Each day, patients will have access to their daily schedules that can be viewed on their in-room TVs. You will also receive all patient meals in your room at breakfast, lunch, and dinner. Our team will work with you to identify other meal options should you need accommodations for personal, medical, or cultural needs. At Children's Specialized, your child's care team is preparing for your arrival well before admission day. To assist patients and families understand their rehabilitation journey and goals, we have created a program called Pathways. Upon admission, you will receive a Pathways binder, which serves as a learn-as-you-go tool that follows your journey here and beyond. The Pathways binder will be used by our care team to provide educational training materials to caregivers throughout their child's admission, as well as prior to discharge. Caregiver education and training is an important part of each patient's care plan, and we ask caregivers to partner with us in all aspects of training. Caregiver training will be coordinated and scheduled with you throughout your stay, along with meetings to review your child's progress. Upon discharge, you will be able to take this binder home with you to utilize as a safety tool and resource guide. Each patient floor features 2 nursing stations that serve as a hub for our team to coordinate and collaborate on care plans every day. Additionally, the 3rd floor houses nursing pods in some infant and toddler rooms. These pods are utilized for closer monitoring of patients who require equipment like ventilators, tracheostomies, central lines, and feeding tubes for medical care. On the 2nd floor, we have a multi-purpose room, which is an open space for patients and families to lounge and visit with each other. Oftentimes, you will find families watching a movie or playing a game together here. There is also a classroom on the 2nd floor for school-aged children. This room is staffed by certified teachers, and once medically cleared, our classroom coordinator will work with the patient's school district to coordinate instructional service and academic support. Lessons are typically scheduled into the therapy day and can be done at either the bedside or in the classroom. The recreation room is on the 2nd floor and offers a stress-free zone for patients when they're not in therapy. This space is staffed by our Child Life and Rec Therapy team members, and patients can choose from a variety of games, arts and crafts, and toys that are ability and age appropriate. This space also hosts evening activities that are scheduled daily. Our 3rd floor offers a fun and colorful playroom for infants and toddlers and is open for playtime when therapies aren't in progress. This space has sensory items and toys for our youngest patients to explore and have fun. Therapies and social groups may also take place in this room. A home-like nursery is also located on our 3rd floor. Rocco's room serves as a learning space for caregivers to ensure they're prepared to safely care for their child after discharge. The main therapy gym is located on the 1st floor. This gym was thoughtfully designed for children of all ages and abilities, and it's the place where you'll typically see our expert rehabilitation team members working side by side with our patients and families. Included in this gym are a rock climbing wall, zero-G gate robotic physical training system, breakout rooms for private therapy sessions, table mats, balance balls, swings, and more. Everything your child will need for a successful physical or occupational therapy session. With a short walk down the hallway from the gym, you will come upon our therapy garden. This is a space for patients to combine a therapy session with some sunshine. The multi-level surface challenges patients to practice mobility skills outdoors, around obstacles, and on uneven ground. It also serves as a nice space for families to take a break outside with their children and enjoy the outdoors together. On the ground floor, you will find the indoor therapy pool. The pool is temperature-controlled and accessible to children of all abilities who are cleared for aquatic therapy, and sessions that occur in the pool are approved and supervised by members of the patient's care team. There is a canoe, underwater treadmill, a basketball hoop, and more. We find that working in water helps children build their confidence and challenges them to learn and support skills that are ordinarily performed on the ground. In addition to aquatic, physical, and occupational therapy, we also offer 24-hour medical and nursing care, speech and language therapy, recreational therapy, pet therapy, psychology, nutrition, and child life services. The daily frequency, duration, and types of therapy your child participates in will vary depending on their unique needs. Our patients will also have access to in-house pharmacy services, respiratory care specialists, and customized medical equipment from our Rehabilitation Technology Department to support getting around their environment during their stay. For our caregivers, we offer access to a family resource room located on the first floor. Family members and visitors are invited to use this space to watch TV, use computers, copier, and printer. You will also find family lounges on each patient floor that provide a quiet space for our caregivers. This space has a computer, printer, kitchenette, and full bathroom with private shower. Family members are welcome to help themselves to water, tea, coffee, and snacks, or they can use the refrigerator to store food brought from home. Additionally, a laundry room for our families can be found on the ground floor. The ground floor also is home to our CSH Marketplace, a free marketplace filled with items to ensure caregivers have what they need while their child is in the hospital. And because Children's Specialized Hospital is part of the Children's Health Network at RWJBarnabas Health and is located on the only pediatric academic healthcare campus in New Jersey, our families have access to countless resources. Thanks to our close distance to and partnerships with Bristol Myers Squibb Children's Hospital, Robert Wood Johnson Medical School, Rutgers Cancer Institute of New Jersey, and the Child Health Institute of New Jersey, our inpatient families have all the care they need in one place, whether it be acute care, rehabilitation, or research. Patient families also have access to other campus amenities, including the chapel and chaplain services, a retail pharmacy, an ATM, a Starbucks coffee shop, vending machines, coffee and water stations, and 2 full-service dining rooms. Additionally, families are offered preferred access to the Robert Wood Johnson Fitness and Wellness Center, which is just a few blocks away. New Brunswick also has many dining options should you want local food options. The care at Children's Specialized Hospital is patient and family-centered care, partnering with every child and family in all that we do. We fulfill this in all the ways we spoke about during this tour and through the employment of family faculty staff members. Family faculty are parents or family members of children who have received or are still receiving services at CSH. They ensure the family voice is brought into all aspects of the hospital and encourage positive interactions between patient families and employees. We hope you enjoyed this virtual tour of Children's Specialized Hospital Inpatient Facility. We look forward to helping your child reach their full potential together.